thank you for having me. It's really a pleasure to be here today and a pleasure to talk to you and be part of this speaker series, which I think really rounds out a lot of what is being looked at, discovered, thought about when it comes to cognitive change. And today we're really going to focus on what are the things we can do in terms of behavior and changing our behavior to be more in line with the research behind trying to preserve cognition longer. So we're going to talk from that perspective today. I don't mind taking questions while I'm speaking. If we find that we're sort of getting off track, I might get us back on track and take the rest at the end. But if there's something that you really want clarification on while I'm talking, feel free to raise your hand. Okay? All right. So I'm part of the Penn Memory Center, and for anyone was anyone here at Dr. Arnold's talk or Dr. Wolk's talk? Okay. So the beginning, where I'm going to just review a little bit about cognitive change, and you may have seen a little bit of that in Dr. Arnold's talk. We always do that to sort of intro. But I'm part of the Penn Memory Center, which is a center that looks at research and clinical evaluation in changes in cognition and Alzheimer's disease and other neurodegenerative diseases. We offer lots of services there, and there are a lot of things that we're involved in. The things that I'm involved in there as a clinical neuropsychologist are comprehensive neuropsychological assessments. I do therapy as well, and intervention programs. So our facilitator for the cognitive fitness program, Scott Reed, is here today, and he'll be here for anyone who wants to ask questions afterwards or get more information. I won't speak about that program in particular, but I'm talking today about the ideas behind why different centers are developing those types of programs, and what are the things we're recommending to people when we see them in the clinic, when they're coming in saying, I feel like I'm having some changes in cognition, or I have a family history of neurodegenerative disease and I'm concerned myself. What are the things I should be doing to try to help to maintain as long as I can? So we'll talk today a little bit about what are the expected changes, because we know that there are changes as we age that we sort of see coming down the pike. We see them in our parents, we see them in our grandparents, and we see them as we're aging. Just because they're expected though, and just because they're normal for your decade, doesn't mean they feel good, doesn't mean they, you take them with open arms. Sometimes they feel pretty rotten. So we talk about that in these sort of clinical settings, but also in terms of how you're going to be approaching these issues. We'll talk today about what are the areas that you want to be trying to intervene on. And the big areas that are really the focus of what we talk to people about. One is cognitive activity. Two is physical wellness. So if I look out in the room here, I know that you're all interested in cognitive activity because you're here. That's sort of a giveaway. How about physical activity? Just by raising your hands, how many people are involved in kind of a regular physical activity program? Okay, that's wonderful. That's great to see. So we'll talk about that, and we'll also talk a little bit about emotional wellness and how emotional wellness or not having emotional wellness can impact cognition. And the thing that we'll talk about today, so you may have heard some of these recommendations in the lay press, talking to your own physician, talking to friends and family. We'll talk a little bit today about what are the things that are recommended, what's some of the research behind it, why is it so important that we're doing some of these things? And then what are the things to keep in mind as you're traveling down that road to really make those changes or maintain some of the changes that you've put in place? So in terms of cognitive change, there are several areas that are really seem to be affected as we're aging. And these areas can be affected at different times in our lives. But the things that we tend to feel get worse with age, and that we see in data tends to show that, is we see forgetfulness, right? Not being able to hold on to as much information as you maybe could have in the past. we see a little bit slowed processing speed. That's one of those things that really peaks very early in our lives. You know, in our 20s is really when that processing speed tends to peak. We see that multitasking is a little harder, right? You can juggle some balls in the air, but maybe there are fewer balls that you can juggle in the air at once, and maybe you need to put one aside and really focus on one thing at a time. That doesn't mean that you can't do it as well. It just means you really need more of that attentional focus on that one task in order to get it done and get it done well. Attention can be something that changes with time, and some people may have noticed during their lifetime that they've always had somewhat of a difficulty with attention, but maybe it was something that you sort of lived with and you learned how to get around. Sometimes as we age, it gets a little bit harder to kind of work around that. And then word finding. This is something that I think everyone that I speak to, and really any age, tells me that they have difficulty with word finding. While I'm talking today, I'm probably going to have a point where I stop and I look for the word, and then eventually it'll come to me, I hope. Or maybe I'll have to work around it. But that word finding difficulty is something that we have throughout life, but it does get harder. It tends to take a little bit longer to get to that word, or it happens a little bit more often as we're aging. For some people, that problem gets to be quite a bit worse, and it gets in the way of communicating. But for the majority of people, we find workarounds. We find ways to deal with it and get around it. This is some data on looking at people over time and over decades. So over here are ages by groups. And what we see here, this isn't very heartening and exciting data to look at as we're aging, because we see a lot of these lines that are going down. The reason why I put this up here is because, one, this is data that we've been showing for a while, and there's some more data that's coming out showing a little bit more variability in this, that it isn't necessarily the case that all of these things are going down over time. We do know that things like vocabulary are maintaining themselves and actually getting improving over time. So this is a little bit of some newer data that actually just very recently came out, which is looking back at older data and saying, well, if we look at people over time and we break down some of these areas of functioning, so things like comprehension and vocabulary and ability to learn pairs of words and things like that, if you look at that over time, is it all going down, or are there different patterns? And while I know this is a little bit busy, the reason why I show you it is because I just want you to see that there are different patterns for different areas of cognition. And some of those patterns are peaking later than we previously thought. That in the 50s, there are some of these things that are just peaking then. And so, I think it's helpful to look at this information and to understand that in the context of feeling like, well, if my processing speed is a little bit slower and I'm having trouble coming up with the words, often that's kind of the overt sign. That's the thing when you're talking to someone, that's the sign that you're feeling like, well, I'm not quite doing as well as I was. But there are lots of other ways in which you're processing information that that is keeping up with prior activity. So this is one of those lines. This is one of those lines where you see all that decrease over time, and you see it going as we age. That this sort of global composite idea of cognitive functioning is declining. But I only show you this line to show you the next slide. And some of you may have seen this, I don't know, Dr. Arnold and I both use this, to show you how busy it is, to how variable people's cognition is over time. So you and the person sitting next to you, you and a friend, when talking about these sorts of things and the way in which your cognition might be changing, may be very different. And so we need to give ourselves a little bit of leeway in terms of, not getting stuck on this idea and understanding that this idea is really out there and that there's a lot of variability in how we're doing. So what can we do to sort of pick out one of those lines and try to maintain those lines as close as we can to steady over time? Well, there are some things we can't do anything about, right? These are all the things we can't do anything about. We can't do anything about our genetics, our sex, our family history. The things we can do something about, this top area here, vascular risk factors. Many people have heard the mantra, what's bad for your heart is bad for your brain, what's good for your heart is good for your brain. This is really a truism and something that we need to keep in our minds at all times, because the more we control those risk factors like high blood pressure, high cholesterol, diabetes, and obesity, the better off we can, the better position we can put our brain in for maintaining cognition. The things that we're going to talk about more today is the stuff on the bottom here. So I have in the middle here head injury. That's one of those risk factors for later decline. Head injuries can certainly happen at any time, and I always put this in here more as a public service announcement that if you're doing things like, if anyone's riding a motorcycle, if you're riding bicycles, if you're doing anything that's a little bit more risky and there could be falls, that you really want to be paying attention to keeping your head safe. Things like climbing ladders, to really be aware of sort of the safety issues there. But what we can do something about in terms of behavior are the things at the bottom here. So all of these things are here in this green circle. So mental activity, physical activity, social activity, and depression and negative affect. We know those things are low amounts of all of these. Low affect are all risk factors for further decline with cognition. And so what we want to do is try to figure out how we can work through those behavioral issues and make some changes. When I think about this, I think about two ways of going about it. One is working around the problem, because a lot of people will ask me, well, what can I do about the word finding? I want to just come up with that word more quickly. Some of these problems we can't necessarily change directly, but we can use our other stronger cognitive functions to work around them. So while, we may not be able to juggle as much in the air, we still may be able to put structures, put systems in place that help us support our memory, that help us allow ourselves a little bit more time to get through a task so that we're performing up at the level we want to be performing at. We just give ourselves more time, we put these structures in place. So that's the compensatory strategy idea, the workarounds, and we're going to talk first around some of those workarounds. And then there's the idea of improving the actual problem area. And some things we'll talk about today in that area are computerized brain training. So we'll talk a little bit about that. That's an area of controversy in our field, how much it works, which ones should be done, for how long. So we'll talk a little bit about that, and if people have questions, I can field questions about that. I won't have one answer for you about this is what needs to be done. A little giveaway now is that there's a lot more work that needs to be done in that area. But training can take on many forms. So it can take on using, things where you're actually training the area of cognition, but it could also take on the form of doing things physically that improve your cardiovascular health, that actually improve blood flow to your brain, that improves the way in which your brain is functioning. So those are some of the sort of workarounds and work through areas. So first idea is how do we work around some of these problems? So for anyone here who is working, If you're working, you probably have some systems in place that you've used for a long time, some strategies that you use, and maybe they're working well for you. What I often find when people come into the office and we're talking about what systems they're using, if there has been a transition from, say, one job to another, from a job to retirement, from retirement to volunteer work, whatever it is, wherever that transition is, oftentimes people don't transition their strategies, and their strategies that help to support their memory and their organization. And so sort of taking a step back, taking stock of what are your strategies, how do you use a simple book to manage your daily tasks, your to-dos, and your schedule in order to make sure that you are now updating how you interact with these strategies based on the person you are today. Because the person who put those strategies in place 15 years ago may have had a different sort of set of cognitive strengths and weakness that you have today. So some of those strategies need to be changed over time. And oftentimes, we don't want to, right? I mean, if it's something that worked for us in the past, we just want it to work. It's very hard to sort of make that transition. So one thing that we do with people who come in and are talking to us about some of these issues is we have a particular book that we use with them, but there's nothing magical about it. It has some of the main things that you would want in any of these types of external compensatory strategies. A place where you're going to have all of the information in one space. You can carry it around with you so that you always have it there with you, because you don't want to be relying on your memory for what you wrote down this morning in a book that you left at home. So it's got to be small enough you can take with you and you have it there whenever you can. And it's got to be able to, in some cases, alert you. So with some people, we're moving over to more use of technology. So for people who are having trouble with, remembering a medication schedule, that's complicated and it's getting in the way of your, all the things you want to be doing, using some technology is something that we're doing as well, and sometimes combining the two. Is anyone here using something like a tablet or a smartphone where you're using it for alerts and you're using it to really help you manage daily life? Yeah. And we're finding, 5 years ago when I was doing this, I would say 15% of people were coming in saying that they wanted to use technology. Now I would say it's more like 70% are saying they want to use technology. So that's a rapidly shifting, changing area. And there are actually students at Penn who are developing apps to help older adults sort of manage the things that they want to manage with technology in a way that makes sense. So this is a very much developing, changing, kind of exciting new area. But the most important thing about using these things is to make it work for you, to make it something that can be a habit over time, that you're going to be able to use consistently over time, and that you're not going to, it's not going to get left in the corner. This particular book was developed in Mayo. It's got sort of the three main things that we always tell people to make sure that they have in these external devices: their schedule, their to-do list, and a journaling area. And journaling for many people can take on different, it's a different take for each person. So some people are journaling really about the emotional content of what is happening, and it can be helpful in terms of mood management. For other people, they're using it as a way of logging what they're doing during the day and some important facts that are transpiring over this period of time. So, the place they went to have coffee, or the corner that they saw someone at, and now they want to remember, oh right, I saw Jane on this corner and we talked about this, and the next time I see her I want to remember that. So those types of things go into that section. So people use it for different reasons depending on what they need it for. But this type of book was used at Mayo, was developed for people who were having mild changes in in cognition and in memory. And what they saw is that when people were using it, they were using it consistently over time, that they were able to sort of get through their everyday, cognitive functions and memory issues a little bit more easily over time. And that was pretty sustained. So this is a type of external device. These are things that you want to be looking at, maybe reevaluating how it's working for you and figuring out maybe there might be something better for you. Or maybe what you're doing is working well, but it needs to be tweaked a little bit. There are also internal devices, internal strategies. So internal strategies like mnemonics, these are kind of tricks and techniques for making learning easier. You probably used them when you were in school, when you were learning lots of new information. And we use them because it's very hard to learn lots and lots of new information. That hasn't changed, in all the time that we've been living it. When we're in school, it's hard to learn all that information. When you're now, some people after retirement are going back to school, taking classes, learning new things. The idea that you can just passively learn all of that is probably not true. It wasn't true when we were in our teens and 20s, so it's not true today. And we probably need a little bit of extra focus on it to get that information in. So what we talk to people about is different mnemonic devices that you could be using. These are internal devices for when you don't have those external devices around. And they help to get information in a little bit more efficiently and with increased fidelity. So these are the types of things that I'm talking about. Are some of the things you might remember are things like 30 Days has September, April, June, and November. Remember that one? Some people remember Roy G. Biv to help them remember the colors of the rainbow. My son said to me the other day, "How can I remember the rainbow? I don't remember which of those colors goes first or second." I said, "Well, your dad's name happens to be Roy, so we're going to use this, and that's going to help you learn what the order is." Helps quite a bit, a great deal. So because those, the idea of the colors being in a certain order, there's nothing to really peg that to. There's nothing to associate that with to make it easier to do it. So you need to make an association. It's kind of like face name recognition. Anyone have trouble remembering names? There's a reason, because there's no necessary connection between a name and a face. It's something you learn over time, and it's an association you create over time. But when you first meet someone, their name and face doesn't go together for any reason besides that they're standing in front of you and telling you that. So you have to make an association. So with those types of issues, what we usually tell people to do is try to make a somewhat absurd association between the name and the face, or something about that person that will help you pull out that information later on. A couple of other things, a couple of other types of mnemonics that we talk about. One are acrostics. This is something that I think is particularly useful with passwords. So the idea of an acrostic is that you take something like a sentence and you take the first letter from each of the words, and then you put it together, and that makes a really secure password. So if you take something that is well known to you, so the idea is you need to take information that you know that's not new. So something old information is the information that stays with you longer. It's a bit paradoxical, but the old information is kind of stuck, whereas the newer information that you learned when your hippocampi weren't, which is the area that helps you to encode new memories, those hippocampi get a little bit smaller as we get older, and so the information that came in when you had the big plump hippocampi gets kind of stuck and is in there more robustly, whereas as we age, the hippocampi are a little bit smaller. The efficiency of laying down those new memories is a little bit lower. So we use the old information to try to make these types of passwords. So something like, my first home was 6 Market Street, exclamation point. you can take that, if you think in your own mind what your first home was, you probably can remember one of the homes that you lived in for a long period of time, or maybe a phone number that you had as a child. Sometimes those stick around for a long time. Take the first letters of all of these, and then you can get that robust, strong, secure password. Passwords are always a problem for everyone at every age. We have too many of them. So for the ones that need to be really secure, you can use these sorts of ideas. Another way that we talk about using mnemonics is what's called the loci method. This is where you take a location that is very familiar to you. So it might be your home, it might be a path that you walk on, whatever it is, it should be a really familiar place. And you take the information that you need to remember and you place it at different points in that location. So this is just a road here, but I'm gonna pretend I'm walking into my home and there's a little table on my left. And the first thing I wanna remember is that I need to remember to pick up my medication. So what I do is in my mind, I'm driving in the car, so I can't write anything down. I'm driving in the car, and I think in my mind, okay, there's medication overflowing that table when I walk in my house, right? That should never happen. I've got little kids. No medication overflowing tables. The next thing I need to do is make sure I pick up my glasses. So what I see when I walk in, say I have a little dog sitting there with glasses on. Silly, but it'll stick in my mind. I have to remember to get my dog some food. So dog sitting there, glasses on a pile of food. That's all over my rug and all over the floor. So absurd, silly, but these are the sorts of things that tend to stick in your mind better and longer. So you want it to be absurd, you want to be able to picture it in your mind. Tends to be the case that things that we can picture are more easily remembered. So I'm going to give you one more example of these types of internal devices. So we've got this set of four pairs here, 4 pairs of words, right? So we've got cow, banana. So if we want to try to remember cow and banana together, and we want to try to do it in a silly, absurd way, we could put our cow in our bathtub. So we're still walking through our home and the bathroom, say, is on the right. Put the cow in the bathtub that's full of bananas. Silly, strange, but I'm showing you this because later I'm actually going to test you on all these. And so I want to see if you feel like you can remember something that you visualized a little bit more readily. So let's take this dress and money. So you're standing in your closet, you've got a dress in there, or maybe a friend or spouse has a dress in there, and it's made of money. Dress made of money. That's sort of silly. It's something that you can picture. So that's another visual that we have. We'll leave the other ones there for now, and later on, I'll ask you. We'll come back to this. I'll ask you about them again. Okay. So those were some of the internal devices that we think about, and some of the external devices, some of the compensatory strategies that we use internally and externally. Well, some of the other things we can be doing to sort of generally raise our engagement in cognitive activities really show in a lot of studies that they can help to reduce risk of Alzheimer's disease over time. So we're going to talk a little bit about cognitive activity, what kinds of cognitive activity. This here is looking at from people who were followed over 5 years, so baseline year 1, 2, 3, and 4. In green are people who did a lot more cognitive activity. So they were reading the paper more. These are engaged activities. Reading the paper, playing chess, playing checkers, going to the library, attending a play. These are, the definition of cognitive activity is pretty wide. And I think it's getting wider and wider as we get more studies coming out showing that you can do lots of different things. As long as you're doing them to a degree that's really challenging you, that's the really important part. So in this particular study, those who had high cognitive activity showed just a reduced risk of getting that diagnosis of Alzheimer's disease down the road. Now, nothing we can do, unfortunately, can reduce our risk to zero, but we can do a lot of things to try to reduce the risk somewhat with all of these different types of interventions. Recently, this was an interesting study that came out, and I like this one because I think it shows the breadth of activities that you can really engage in that are considered cognitive activities and really can show improvement. So what they did here was they were looking at productive engagement activities versus just kind of receptive engagement. So if you're here and you're receiving, this information where I'm talking, you may leave and you may not think about it again. If you engage in a discussion about what we talked about today, that sort of ups the engagement. If you then do some research on what are the things that you want to be doing and maybe pull out some articles, or you email me and you say, you know what, I want an article about that, you're engaging more and more over time by doing those things. So this study was looking at productive engagement versus sort of a more passive engagement. Their productive engagement was really interesting. They took two types of engagement. One was learning photography, and one was quilting. So this was not, sitting in a circle and, snapping a few pictures, or having someone give you a design and saying, sew this line and just go do it. This was really engaging in these activities so that people were doing about 15 hours a week of learning about quilting, about designing, about the equipment. Photography, same thing, learning about all of the intricacies of photography itself, about producing photos, about mathematics that played into all of these, to both of these. And what they showed in a couple of different areas of cognition is that the productively engaged group was scoring better than the non-productively engaged group. Now, both of them showed some improvement, but the people who were engaged more productively showed more improvement, and significantly more than the group that got together. They talked, so this receptive engagement group, it was a good control group because they were all coming together, they were socializing together, they were doing some activity, but it wasn't that type of cognitive challenge of the other groups. And that's really where the difference is. We know that socializing and social activity is a positive activity for cognitive health. But on top of that, this type of challenge where you have a challenge that can get harder over time. So with many of the hobbies we engage in, if we get into them, we could actually step it up over time, right? You could stop. You could learn how to do a new hobby and stop and sort of be content with that. But the idea of pushing yourself to the next level continually and seeing, what more can I do to challenge myself? That's really where the change seems to come in terms of cognitive functioning. So certainly the first thing is you want it to be enjoyable. And I think that's the great thing about seeing this breadth of the types of cognitive activity you can engage in, because you want to pick something that you like. It's going to be something different than maybe your neighbor, partner, or spouse, but you want it to be something that's going to challenge you. You shouldn't be able to do lots of other things while you're doing this cognitively challenging activity. You should really have to focus on it. And it should be able to get harder with time, okay? If you can make it something where you're socializing as well, or there's physical activity engaged as part of it, all the better. Because if we can get 2 for 1 in some of these activities, that's great. There's only so much time that you have in your day to do these things, so if we can combine them, that is usually a positive. So these are just some illustrations of some of the different things people do. So things like bird watching. You can go out and you can take your binoculars and look at birds. But then you could take it a step further and you could get the birding book and you could start to meet up with a birding group and you could record what you're seeing and what you're hearing. And so there are different levels to all of these engagements. All right. So we're going to talk a little bit about computerized brain training programs. So what's the one everyone's heard of? Yeah. So Lumosity is a very big, it's a widely advertised program. There are some other programs that are also advertised, but it's the one that most people know and most people ask me about. All of the programs that are out there, they tend to start from the same point. You know, they're all trying to do something that we were talking about on the last slide, give you a cognitively challenging activity that gets harder and adjusts to your level of performance. That is something that computers do really well. And so, you know, in theory, that is how we could be capitalizing on this idea that pushing you and pushing your performance up with more challenge over time can really be done in a kind of a computerized setting. The thing we don't know is, well, there are several things we don't know. So we don't know which of those programs work well. We don't know which ones work well for which people. And I think that second question, I think, is the really big question. You know, the programs out there have about 30 different tasks that you can be engaging in. Some of those tasks might be really helpful for some people, and some of the other tasks might be really helpful. I think what we need to know about it is which ones are helpful for which individuals. What we know so far is that some of the programs have shown some improvement in some groups. When we run our programs at the Penn Memory Center, we do use one of those computerized programs. We have people do it at home. We don't spend a lot of time now in class doing it, but we ask people to do it at home. And we always try to keep people on the tasks that were used in the studies that showed the results. Since those studies have been published, the companies have come out with lots of other tasks too. They might be equally good, they might produce the same effects, but I don't know yet because I haven't seen any studies on it. So what happened with some of the companies like Lumosity is that they led with their marketing foot, and they really have widespread appeal, and they're marketing in lots of different areas. And now they're doing some partnership with different universities to do studies. So that, I think, will be great down the line to see what's coming out of that. But we don't have a lot of information on which of these programs are really helpful. Some have more data than others. When we had to choose one, when we decided we wanted to choose one, we chose one that we felt like had the most data at the time. That can change over time, certainly, and we're sort of constantly keeping our eye on it. So the program that we decided to go with did a study of about 250 people who did 40 hours of training on a set of tasks. And they compared them to people who also came together. They were a contact control group that came together and did not do the training. And what they saw was they saw some improvement. They saw some improvement in memory. They saw some improvement in processing speed. I'd say processing speed and executive function, sort of the organization, those are the areas that tend to show more improvement. There are some of these programs that are out there that are really targeted at children with attention deficit disorder, and those have been used to some degree, with some success in those populations. But really checking how these work in different populations, I think, is a really important part of the process. So that's my lukewarm endorsement of these, and we can talk more about them afterwards. The thing that I will give you a much stronger endorsement on, and was really excited to see so many hands up before, is physical exercise, because physical wellness is one of the areas and interventions with physical exercise are the areas that we're really seeing a lot of the larger effects on cognition. The larger effects, we've known for a while now that they have a positive effect on mood and affect. For anyone who's felt down and depressed, if you've sort of treated yourself at home a little bit with activating yourself, exercise is usually one of the things that you find that you get a lot of response in terms of your mood. For people who have gone into any type of therapy, usually that's something that is suggested, that you're doing more exercise and behavioral activation. So physical exercise and physical exercise on many different levels can be really helpful. So, it doesn't have to be marathon running. It's walking in a lot of the studies, and walking more, walking with friends, getting up those numbers. So what I want to show you here just briefly is, there's a decline over time in terms of our physical abilities. We know that. Most professional athletes are in their teens and 20s, so we know that there's that decline over time. But the idea of making sure you start out at the highest possible level from which to change from is really an important one, and has been shown to be important in terms of wellness over time. So this idea that if you started here, you end up at a much lower level than if you are starting up here. The thing that I think a lot of the studies more recently have been showing is that someone who is has not been active and would be called a couch potato can really up their physical exercise game and can get a lot of the benefits. So, just because you haven't been doing it doesn't mean, that's not a reason to to continue not doing it. So when we look at these interventions with physical exercise, there's a lot of data out there. And so I'm not going to data blitz you on all of the different studies, but what I'll show you is some of the areas that have been shown in multiple studies over time to be helpful to cognition. So memory is one that's shown pretty consistently. You can see some improvement on memory. You can see improvement on executive function and in many different areas. So ability to think flexibly, to sort of switch back and forth from one thing to another, to ignore irrelevant data and focus more on the relevant data. Attention, so being able to focus yourself in, select what you want to be looking at and paying attention to, and then getting to that. All of those things have been shown to improve with physical exercise. As well as processing speed, so that one that we know is, peaks really early, we can improve that, we can increase that a little bit. And with physical exercise, that's one of the areas that we see. We also see some basic improvement in motor function. So just being able to, in terms of your dexterity and speed to doing things, that you can do that faster. So we know that the data is out there for doing those physical exercise and the improvement on cognition. And more recently, we're seeing data on what are the effects on the brain. And what I'll show you here is a study that looked at people over a year period. So people who came in, they were not exercisers before this. They went into one group or the other. They either did exercise 3 times a week. They were walking, not running, walking briskly, at a pace that would raise your heart rate, but was safe for those that were in the study. And this was all for older adults. They came together 3 times a week for an hour, did this walking exercise, did it over a year period. The other group came together 3 times a week. They hung out together and they did some stretching and those sorts. And I think it was just stretching exercises. So they were still together, they had that involvement. The group that did the exercising, the walking exercise really showed those improvements in cognition, but they also showed increase in the size of the hippocampus. So that structure that I said earlier was the one that we need to lay down new memories. They showed over time, comparing from their baseline the first time they came in to 6 months and then a year, the top here, these little yellow dots, those are covering the hippocampi on both sides. And the blue lines are the ones that indicate the exercise group over time. And this is just showing one side of one hippocampus and the other hippocampus. And there have been other studies since this time that have confirmed that you're seeing some structural change in the brain. Now, as a neuropsychologist, I believe it when I see change on cognitive tests. I think, oh, well, that's great. That's what we want to see, and that's what people feel. But we also, want to see what is the structural change, what's happening within the brain. And so we're seeing some of both of those. The other thing to think about when we think about exercise is some of the other areas that it helps us with, right? Some of those changeable risk factors that we saw in the beginning. So managing diabetes, heart disease, blood pressure, osteoporosis, all of those things. It can really help in a lot of these studies. They show help in just everyday activities. So being able to get through the things you want to be doing. You have more energy. You have, often more stability. A lot of these studies are focusing on exercise that raise your heart rate. So more cardiovascular exercise like brisk walking. But there are certainly benefits to a lot of the other exercises that people do and are probably recommended to you. Things like balance, flexibility, and strength training. Those haven't necessarily been shown to be associated with cognitive improvement, but they're certainly associated with lots of other areas of health. So when we talk to people about exercise, we talk about all those 4 areas. We talked already about the way in which it can help improve symptoms of depression. And group exercise, it increases socialization. It's a way to get out and be socializing more, which we know is helpful. And it could also improve adherence. The idea that someone else is counting on you to get out there and do it with them can really help you get out when it's a rainy day or it's cold or you're not quite feeling up to it. Sometimes people even use a kind of a check-in system where if it's cold and snowy and you feel like it's not safe to go out to where you do your exercise, that you call and you check in with your exercise buddy via the phone or something of that sort, so that you can still be doing it, you still have that motivation, you still have that kind of push to do it. All right, so we talked a little bit about physical exercise on its own. Some of the studies have looked at physical and nutritional wellness. And the focus has been primarily, when we talk about nutrition, the most data has come out on the Mediterranean diet. This idea that you're going to be eating lots of fruits and vegetables and legumes and nuts, things like olive oil, and all the meats and sweets are the rarely eaten items at the top. Physical exercise is always included whenever you see any of these types of pictures. Physical exercise is always included on there. But what they've shown, and what this is showing over here, the top darkest line is the line that shows the risk of developing Alzheimer's disease for those who, for the top line, had high physical activity and a diet that was more adherent to a Mediterranean type diet. As you go down, so that is indicating that they had less risk of developing over time. As you go down to these hashed marks, these are people with lower physical activity who had less adherence to these diets. And most of these studies, they do control for things like education and some socioeconomic factors. They try to control out for those. Of course, they can't perfectly control for them, but they do try to make an effort to do that. So those are some of sort of the physical things you can do in terms of eating and physical exercise. You know, we know that there's a lot of data behind that. We've talked a few times already about the idea of incorporating social engagement and social ties. And this is because there is some data out there that shows that the more robust, the more social ties you have, the better off you do over time. So what this shows here is this is percent of people with cognitive decline. So the taller the bars, the more cognitive decline. Here are people that reported no real close ties to anyone. People with 1 to 2 ties, 3 to 4 ties, 5 to 6 ties, so more social ties, moving to the right. And this is following them over time, so 3 years, 6 years, and 12 years. And for everyone, of course, we expect that there's going to be that change in cognition, but for those with more social ties, they had less decline over time. And you know, I think the idea of incorporating this when you're thinking about physical wellness and when you're thinking about the activities that you want to be spending time doing should enter your mind and be a part of that decision-making process. It usually is a real deliberate type of approach that you need to take in order to make that happen. Particularly what we hear from a lot of people is that if you're having word finding problems, if you're feeling like your memory isn't quite as sharp as it was, and you're feeling a little bit self-conscious about it, and that's what people are telling us this. I'm feeling self-conscious and I'm less likely to get together with my friends, and I'm less likely to join a new group. You know, I'm less likely to go to that book group or to go to this lecture or to do that because I'm concerned about how I'm going to perform. And addressing that question and how to address that question is an important one, and that's going to come up in our next slide on emotional wellness, because emotional wellness, anxiety and stress about cognitive change, and low mood because of perceived cognitive change is something that we see as quite real in people who are coming into our clinic. Even if we're not seeing a lot of change on our tests, the report sometimes is, I feel it, and I don't care what your tests say, I feel it and it feels bad. And so, you know, we have to think about, well then how do we address that part of it? How do we address that reaction that you're having? It's a very real reaction, and how can we help to improve your, you know, your approach to it over time, so that it's more proactive, and so that it's more deliberate, and so you know you are able to incorporate these things that we think would be helpful, but we have some of these hurdles to get over, and some of those hurdles are stress, some of those hurdles are low mood. So some of the things that we work with people on is, you know, finding what would be the space they would be comfortable in, what are they interested in, what types of volunteer activities, and I know here you've got a lot to choose from, and you can find, probably everyone can find something that would suit them and their personality and what they're interested in. And we work on trying to find, you know, what are those groups and what are those avenues that they want to pursue. Mm-hmm.
One thing regarding physical activity, what does sleep establish
So sleep definitely impacts. So the question was, how do sleep patterns affect cognition, right? So sleep absolutely does. It can affect the efficiency of consolidating memory over time. If you're not getting good memory, it can. If you're not getting good sleep, it can also affect your attentional capacity. It can affect the number of balls you can juggle in the air. all of those things can really be affected by your sleep. And one thing that we actually recently added into our little group was a lecture on sleep and how sleep does change as we age. And that sleep is a little more broken in the night. Your actual patterns change. And sleep hygiene, which is something that people usually don't pay a lot of attention to, but has become in the recent years increasingly problematic, particularly with people using a lot of devices and then keeping them up or having them in bed and things like that. And so one thing we do counsel people on is we give them sort of guidelines for sleep hygiene. Some people who are really having a lot of trouble with sleep may be having trouble for different medical reasons. So sometimes people develop something called sleep apnea, where their breathing stops during the night and they're sort of waking themselves up and their sleep is quite broken from that. So many people who come through the clinic who report sleep problems end up getting a sleep study to check if they have any sleep issues that are related to apnea or other medical conditions. And then for other people, it's not necessarily the medical conditions, but it's that sleep hygiene and really getting into a pattern, particularly if there's been a transition from working to not working or moving to another place, and sort of making that transition and sort of recalibrating their sleep. But it absolutely can and does affect cognition. Yeah. So we'll talk a little bit about emotional wellness. So we've talked about it kind of peppered throughout the last hour, and how depression can affect cognition. And the things that we specifically see in people who have low mood or depression, chronic depression, and who go into depressive episodes is decreased processing speed. So that's one of the things that we know is going to go down a little bit with age, but it goes down more with depression. Also, efficiency of memory tends to get worse when you have depression. So the ability to take in information and be able to consolidate it and then effectively pull that information back out. Oftentimes people are not quite getting the information in as efficiently as they used to. They may be able to recognize that information, but the free recall of it is really tough. With anxiety, we see a lot of impact on attention, an ability to really take the other pieces of your thought process and put them aside and focus on what's in front of you. When anxiety levels go up, all of those things tend to just pile on. And this idea of your mind being constantly in the future and anticipating what's about to happen on any possible road that you could go down. And that's an exhausting place to be, and it's a distracting place to be. And it makes it harder in just an everyday conversation to take in information and to take it in well and to put it into memory. So sometimes when people are having trouble with memory, and the reason is something related to mood, it may be that they're having trouble with the information coming in and attending to it as it comes in, or it may be that they're having trouble organizing as they're trying to remember it. But it can have a couple of different kind of faces. People often say that the problem is memory, and it is in a way related to memory, but it may not be the function necessarily of the hippocampus, that place where we consolidate our information. It may be other places in the brain where we know depression has an effect and anxiety has an effect. So what we do see in many cases, is that when people are treated well and they have low levels of depression that are treated well, and then they kind of go back to their baseline of feeling good and hopeful, is that some of these cognitive problems will diminish. And so we can see some improvement there. In terms of attacking that problem. That's something that we take a pretty aggressive approach on, because it is one of those effects on cognition that's reversible. You know, it's just like sleep apnea. Sleep apnea can affect cognition, but if we treat the sleep apnea, some of the issues that were related to sleep apnea that affected cognition will diminish. Same thing with emotional wellness. If we can treat the depression, if we can treat the anxiety, we can really see improvement in everyday function, we can see improvement in cognition. And there are many ways to go about that. You know, things like individual therapy, some people like a group setting better. We find that people who have they have low mood or problems with stress related to their changes in cognition, who come into say the groups that we run that are around helping with cognitive change, the report back that we get are things like, I feel more confident, I feel like I can try something again, because I now have this peer group that understands, and I can reflect back and forth some of the difficulties that I'm having, and I hear that it is not me alone, and I hear that they're having some of the same difficulties, and they have had some success in, you know, moving beyond them by taking some of these approaches. And so for some people, that group setting can be really powerful and helpful. We also use mindfulness meditation in our group, and there are lots of opportunities in this region to get involved with mindfulness meditation. Both Penn and Jefferson have programs in and outside of the city. And the reason why we use it is it's sort of twofold. One is that it can help with focusing the person in the moment on the task at hand. So kind of a practice for attending to one thing at a time. And then the other thing is that anxiety reduction or stress reduction that we usually see as a result of someone developing a mindfulness practice where every day they're really focusing on experiential learning around attending to the moment, in the moment, sort of putting everything off to the side and being able to do that over and over again. And that practice can then be used in the moment when you're in that conversation, your word goes away and you have all this chatter that starts and says, oh gosh, I just forgot that word. Oh no, what am I going to do now? Where am I going to go from here? Now I've forgotten what the conversation was because I'm busy talking with my own voice here. So, you know, to be able to practice kind of putting that stuff aside and say, you know what, I'm just going to take a breath and I'm going to refocus myself and we're going to move on. And that can really kind of stop that, you know, cascade of stress and anxiety in its path and allow you to move on in that moment. So we use it in a couple of different ways there. All right. So we're getting towards the end here. A couple of the things that, you know, we usually want people to sort of walk away with is, one is to know, you know, some of the lifestyle changes that are protective to brain health, to sort of reiterate and make it really solidify that idea that you want to be making those changes. And then to use some new strategies and to think about what are the new strategies that you can implement to work around some of the areas of cognitive weakness to help some of the areas of use some of the areas of cognitive strength to help those areas that are weaker. And then to really have a set of goals that are specific to you that you can try to stay with, that you can try to stay on track with. And for many people, even writing it down and having a set plan that they try to go back to can be really very helpful. So I'm going to end with two different studies that have looked at interventions that incorporate all the things we've been talking about. So physical activity, cognitive activity, treatment for emotional wellness. There's a group out in Washington that did a 3-month study
where they were looking at how people did when they came in and met twice a week, for 10 weeks, and they did all these things and they started to develop new habits. And they saw improvements in everyday functioning, they saw improvements in neuropsychological tests of memory. That was in a small group. But recently in Finland, they had a very large study that was a couple of, I think it was about 750 in each group. And what they were doing was they did a 2-year study of diet, exercise, cognitive training, and monitoring all those cardiovascular risks over these 2 years. And they were showing improvement in processing speed. That's one we see coming out a lot. In their sort of total functioning score and executive functioning. A little disappointingly, they didn't show it directly in memory. And one thing that I think is an area of interest and research that's developing now is how can some of these other areas compensate for some memory decline? Because we know that our hippocampus, it's hard for it to keep it nice and plump for all time. So what are the other things that we can be doing? What are the other areas of functioning we can be help using to support memory if we can't really kind of push through that problem, but more work around it? So one of the last things I'd like you to do is think about, in your mind, if you can remember the word that went with cow. Okay. And bird? Okay. Dress? House? Okay. Now by volume, it sounded like you remembered the first and third more quickly, but in your own mind, you can think about whether or not that was true for you. And let's see this. So you were right on all of those. So it tends to be the case that those visualizable ones can really be remembered with greater fidelity. So just a take-home message, the things that you want to be trying to do is really finding those cognitively challenging activities and seeing if you can up your game in those. So if anyone plays bridge, well, that's a tough game to play. You're always kind of on your game when you're playing. But for other things that you need to sort of up the cognitive challenge, look for how you could do that. What are the ways in which you can make it more challenging? That being said, I don't think every moment of every day should be spent in cognitively challenging activities. We need rest. Our brains shouldn't be on overdrive all the time. You need some time when, you are relaxing and you're not doing something that's absolutely pushing and driving you. So you need some balance there. Physical exercise, figure out, what are you doing and can you do a little bit more? Is what you're doing exactly, where you should be? It may be. For some people, using things like activity monitors, those little Fitbits and those sorts of things can be helpful because it gives you some feedback on how much you're doing, and you can use that feedback to then increase over time what you're doing. Think about your diet, and is it looking somewhat like the Mediterranean diet? Are there things that you can make? Are there small changes you could make? Substituting certain oils for butter. Making small changes that can really kind of get you more in line with that. So yes, sure. Mm-hmm. Well, I'm going to look forward to that too. Uh-huh.
I guess I could put that in one class, because I feel like I'm two classes.
Yeah.
But the kids, they're small ones.
Yeah. So the question was about wine, and if you have 2 glasses of wine a night, is that okay? And because I also have read lots of mixed reviews on how much is the right amount, and because each individual has a different set maybe of medications or medical issues, That's one thing that there is some data that wine can be helpful in several different areas of health and cognition. But it's also something that you just want to check also with your physician for anyone who's concerned about that because of interactions with drugs and those sorts of things. The other thing that alcohol in the evening can affect is sleep. So that's one thing that sometimes people find that if they're drinking a few, an extra cocktail, that their sleep is affected and they're not able to, they sort of fall asleep and wake up at some point, and then their sleep is affected by it. So that's one thing that people kind of take stock of and kind of play around with and see if maybe they need to change the amount or when or how often they do it because of effects on sleep. Okay. So the last thing I'll say before we get into any more questions that are out there is the idea of changing habits into making these changes become habits. And that is often hard to start a new habit. So, as much as you can associate a new habit with an old one, that can sometimes make it easier to kind of incorporate that new one into your new rhythm and your new system. So sometimes people who are wanting to start to exercise more will incorporate that, make that a paired activity with reading the paper. So they don't actually take out the paper until they've done their exercise. And that helps with kind of making that transition and making those habits stick and keep them around. And the last thing is just to kind of make a plan and recheck it, because those plans should change over time. They'll change by your needs, they'll change by your circumstance, and so we always encourage people to really check over those and figure it out anew every year or so. All right, that's all that I have for you today. Thank you.